So when I started with the Clinical Champions programme, our real focus was around how we could try and make care more flexible for people with diabetes, and partly through the use of technology, so encouraging more in the way of sort of virtual consults, allowing people to upload blood glucose readings remotely, get support online through various platforms, so that they can take more responsibility and ownership of their care, give them their data, deliver the education they need, and support them through online tools. And we've done that, and we've continued to do that through a number of pilot projects throughout, both within Tayside, our locality, and now within about 5 other regions in Scotland. So that's been fantastic. But the programme, interestingly, has taken me down different avenues that I didn't think we would go down. So through the UK network that we've got, we're now doing some partnership working with other groups in NHS England to actually try and implement some of the technology approaches in Scotland into other centres in England, and we've been writing some grant proposals around that. But it's also allowed us, for example, we recently produced a massive online open course, which is a free 2-week diabetes course for anyone living with diabetes, healthcare professionals. And we had about 8,000 people who signed up and did that course, and we did that in partnership with Diabetes UK, Diabetes and Diabetes Scotland. And again, it was only really through the network that we built up through the Clinical Champions programme, and that sort of understanding of how we can work with Diabetes UK, Diabetes Scotland, that allowed that particular sort of educational programme to emerge. So there's been lots of new things that have come out of the programme that I would never have imagined.
So I think there's a number of ways. I mean, in a sort of big picture view, I now feel that I have got a voice on the CCG group that I'm part of and within the trust. I think I can champion diabetes, but not just as a representative saying diabetes is important, but actually I think I've now got the tools and skills to actually make changes and even lead change. And that's really apparent now at the meetings of the network or the CCG, where I'm not just a sort of passenger, but feel that I'm often either leading the discussion or certainly pushing the discussion in the direction I think it needs to go. I've started doing some virtual clinics within general practice, which we're now about, having had a meeting yesterday at the CCG, looks like they're going to be commissioned. So not only will I be doing them as a pilot, but there will be some money for them. And we're also doing a project looking at hypoglycemia and working with the South West Ambulance Service. So there are some very tangible changes and developments that I've managed to do since being a clinical champion.
So I've used networking. I've used the opportunity to actually liaise with a colleague in Kings, and he's been working on an idea to produce a lanyard, and we've been working in collaboration with him to make it suitable for local needs. And the idea is that we will be able to produce these devices, to trial them on the wards, and they will act as prompts for the nurses or the healthcare support workers to undertake diabetic foot screening.
There were about 4 projects that I thought about when I came into the Clinical Champions programme. Some of those had already started, and some of those were things that, particularly myself, I'm very interested in promoting structured education that we've not had an opportunity to take forward to our local organisation or to the CCG. One of the main successes has been devising a guideline for the management of diabetes in the older person. The area that I work in, we have quite a large population of older people, and we were finding there was an increased incidence of hypoglycemia in that particular age group. So we devised guidelines both for use in hospital and in primary care to help limit the risk of hypoglycemia in that age group and maybe use more appropriate treatments for people as they get older. Looking at structured education, which particularly for me and other members of my team is a particular concern of ours, that we were not able to access funding for our structured education courses, particularly for Daphne. And what the programme has given me is a way into the clinical commissioning group and meeting with people who are in charge of commissioning services and seeing if there's a way that we can move forward to actually fund structured education in our area for people living with diabetes, but also devise a training programme for GPs and practice nurses to upskill them to be able to help them manage their ever-increasing caseload.